So hello friends, welcome to my new video. So today in this video I'm going to discuss with you all about a very important topic, that is cataract. So cataract is very important for you as an optometrist because you are the first person who make contact with the patient, and then after you it's time for ophthalmologist. So whenever you are dealing with patient who are having cataract, you need to identify what is the type of cataract, and also you need to know that what is the cause of that cataract. Okay, so for that purpose you need to know what is the basic anatomy of lens, and also what are the parts of lens. Okay, so in our bookish knowledge we studied that lens is having nucleus and cortex. Okay, but beyond that lens have several parts also that we are going to discuss. Okay, so this is the basic human eye cross section, where you can see that this is the cornea and this is the lens. Okay, so the lens, if we go for the definition of the crystalline lens, then we can say like the lens is a transparent structure which is located behind the pupil, and it allows the light to pass through and help the light rays to get focus on the fovea, because cornea is having refractive power of plus 43 diopter, and lens is very important part to make the light rays to get focus, because lens is also having its refractive power of plus 18 diopter, and in together the total refractive power is plus 60 diopter. Okay, so lens is now helping to make the light rays fall on the fovea properly. Okay, so just think about it, that why the light rays is able to get focus on the retina, because lens is transparent. So if there is a decrease in the transparency of the lens, then the light rays will not get properly passed through the lens. That means the patient will have blurry vision. Okay, so this is the structure of the lens, where you can see that different parts are given here. So this is the equator area of the lens, crystalline lens, and this area is called pole. Okay, this is the pole, anterior pole, and this is the posterior pole. Okay, and you can also see that this is the capsule, and the cell line that you are seeing is the epithelial cell. Okay, now this epithelial cell membrane is now continuation in the both anterior as well as posterior. Okay, and this is making the capsule of the lens. Behind that capsule it is having cortex. Okay, and in between the capsule and the cortex, this area is called subcapsule. Okay, so behind the capsule it is called as subcapsule. Okay, and behind that subcapsule the cortex is given. Okay, and if there is any cataract in the subcapsular area, then you will document as subcapsular cataract. If there is any opacity in the cortex area, you will write as cortical cataract. Okay, and um, in between the cortex and the nucleus, this part is also called as supranucleus. Okay, and if there is any formation of cataract in that region, you will call it supranuclear cataract. And if the cataract is in middle of the lens, then it is called as nuclear cataract. Okay, so these are the basic division of the parts of the lens. This is the pole, these are the equator, this is the cortex. In between the cortex and the capsule, this is subcapsule, and in between the cortex and the nucleus, this is supranucleus, and this is the nucleus area. Okay, so now another thing I want to tell you, that the lens is when the baby is born, initially the lens is spherical in shape. Okay, and when the baby grows, that means the baby become older, then the spherical lens become biconvex. Okay, and it's more curved or more steeper in the posterior part than the anterior. Okay, now here you can see that different nucleus are given. Okay, so what is that nucleus? So when the baby is born, then the nucleus is called as embryonic nucleus. Okay, and after that embryonic nucleus, when the baby become older, that means we will call it as fetal nucleus. Okay, and uh, after that fetal nucleus, the baby took birth, and from birth to puberty, the nucleus which is growing in stage we will call as infantile nucleus. Here it is marked as infantile nucleus, and after puberty, the growing stage of the nucleus is called as adult nucleus. Okay, so lens is the only organ in our body that keeps growing whole lifetime. Okay, now the lens is made up of transparent protein called crystalline. Okay, so these are the divisions of the protein in the lens. So here water soluble proteins are there and water insoluble proteins are there. Now basically water soluble protein are seen in the cortex area and water insoluble protein are found in nucleus area. So water soluble proteins are alpha crystalline, beta heavy, and light crystalline, and gamma crystalline. Okay, and they are mainly found in cortex. And water insoluble protein like albuminoid, we can find this type of protein in nucleus area. Okay, and here another thing is the average concentration of the lens protein is about twice than that of other intracellular protein. Okay, so the composition in the nucleus area, the protein is the more than any other organ in the body. Okay, now cataract may be easily diagnosed with the use of slit lamp. So in slit lamp, you need to make an optical section and you need to examine what is the type of cataract. Okay, so I will show you some pictures of the cataract taken by this optic section, so that you can understand properly that how to see a cataract properly with the help of a slit lamp. Okay, and here I wrote like a visual acuity test. In addition, visual acuity test, here the eye chart will progressively smaller later from top to bottom. We can, whether you are using Snellen chart, Logmar chart, anything, and will determine how well the patient can see with cataract. And when significant loss of vision is noted, the treatment is to surgically remove the lens. So many times you will find patients who will tell you that is there any drop available to treat this cataract. So you need to tell them that there is no such drop is ever invented that can treat cataract. So surgery is the one and only option to remove or to manage the cataract. So this is why it is called as cataract is the reversible blindness. Okay, now these are the types of cataract that I am going to discuss with you all. Now cataract, here cataract, this is two types, congenital and acquired. Congenital means cataract which is present in babies, and acquired means cataract which is present in older age, or which is appeared in older age. Okay, now congenital or childhood cataract are congenital and developmental or infantile. Okay, so congenital means cataract are present when a baby born, okay, or baby took birth, and shortly afterward the cataract is present when the baby is born, then we will call it as congenital. Okay, and developmental or juvenile cataract, that means cataract diagnosed in older babies or children, not in the adult but children, but the cataract appeared after baby took birth, so it will call as juvenile cataract. Okay, so there is some types of cataract. So before that we need to discuss what are the basic causes. Okay, so here I wrote it can be due to malnutrition, infection during pregnancy, and if the mother took any steroid medication, mother infected by rubella, or any genetic causes like congenital rubella, Down syndrome. If there is any genetic disorders of Down syndrome, then this Down syndrome also can lead to cataract. Now another thing is that ectodermal dysplasia, or this type of genetically or hereditary disorders will lead to cataract. Okay, uh, or suppose the mother took some steroid medication, as I already written here, or took some alcohols or get infected by rubella, this thing can lead to certain what to say, bad impression or bad effect to the baby, and it can lead to cataract. So those will be congenital cataract. Okay, and when it is time for acquired cataract, this is traumatic cataract, metabolic cataract, senile cataract, and complicated cataract. Traumatic, from the name we can easily understand it is due to a trauma. Metabolic cataract means there is a metabolic disbalance that can lead to cataract, that is metabolic cataract. Like if the person is having diabetes, so from that diabetes, if there is any presence of cataract due to diabetes, we will call it as metabolic cataract. Now senile cataract due to age, okay, due to growing age, if there is a formation of cataract is there, then we will call it as senile cataract. So it is two types, nuclear and cortical, where cortical is the most common. Okay, and another thing is that complicated means if the cataract is due to other diseases in the eye like uveitis or any other diseases like retinal detachment. So if cataract is due to this thing, then it will be a complicated cataract. Okay, so let's move to congenital cataract. Again, here I am showing you some picture. So here you can see that the child is born with cataract. So this is congenital cataract. So I already discussed with you all what are the causes of this cataract. So it can be due to maternal infection, or if the mother took any steroid medication or alcohol consumption or any type of infection, rubella, or any type of genetically hereditary disorders like Down syndrome, this can lead to this type of congenital cataract. Okay, so this congenital cataract will be due to genetic, but in case of juvenile or developmental cataract, it can be due to a trauma. Okay, so here you can see a total cataract is there. Okay, the total cataract will look like this. So this is mainly due to growing age. So we will call it as senile cataract. Can you recognize what type of cataract it is? It is a nuclear cataract. Okay, so nuclear cataract will look like this. So this is the lens cortex, this is the capsule, these are the equator, these are the poles, and this is the nuclear cataract. Okay, so when there is a presence of nuclear cataract, the lens will not become thick, but when there is a presence of cortical cataract, then the lens will be thicker. Okay, so equator area, that this equator area will grow from to a certain age like 20 years, but this pole area like anterior pole or posterior pole, this will grow lifelong. Okay, so if there is a formation of cortical cataract in an older patient like 75 or 80 years, and the patient is not undergoing any cataract surgery, then the lens will become very thick in size, and this thick lens will push the iris forward. That can lead to closure of the angle. So when we will perform Van Herrick technique to that patient, it will be a grade 1 to 2. Okay, that means there will be a PACD is equal to 1/4 CT or less than 1/4 CT, and it can lead to glaucoma also. That glaucoma will be called as phacomorphic glaucoma. Okay, this is a nuclear cataract, as well as some posterior subcapsular cataract is also present. Okay, so this is the polar cataract. Okay, this is the traumatic cataract where there is typical star shape formation of cataract is there. Okay, this is the cortical cataract. So cortical cataract here coralliform formation, cuneiform, sorry, where there is a projection from the peripheral area to the central area. So another thing I want to make you clear that suppose the patient is having nuclear cataract. Okay, so basic symptoms or complaint that the patient will tell you that he will or he is facing no issue in night time, but he is having difficulty in daytime. That is called as day blindness. Why? Because in nuclear cataract, the nuclear portion of the lens is opacified, but peripheral is still remaining. Okay, so in the daytime, when pupil is in smaller size, then the light rays cannot pass through the nucleus area properly, or the light rays is passing very less. That leads to deterioration of vision. But when the patient is in at night, then the pupil is dilated, and due to the dilation of the pupil, light rays can pass through this peripheral area, so that the patient visual acuity will improve. Another thing or another thing that the patient will tell you that he can read the near object clearly, but he have difficulty in distant object. Okay, so this is because of the myopic shift in the patient eye, because in nuclear cataract what happen is that there is increase of refractive index in the lens nucleus due to more denser of the nucleus. So nucleus become hard. Okay, and this hardening leads to more refractive index than normal, that is 1.408. So this higher refractive index will lead to more bending of the light rays in front of the retina. So suppose normally the light ray is coming and getting focus over here. Now due to that higher refractive index, light rays are focusing over here. Okay, so this is the so the patient having less problem in the near, because the light rays are now focusing little front. Okay, so when he is putting a near object, then he can see that thing properly. Okay, and this is the cortical cataract. So in cortical cataract, the patient will complain just opposite to the nuclear cataract. So the patient will tell you that he have no issues in daytime, but he have difficulty to see at night, because you can see there is a peripheral opacification of the lens is there, but central is clear. So in daytime, when the pupil is in smaller size, then the light rays can pass through the central area, but in the night the light rays pupil is dilated and light is passing through the peripheral area also, but peripheral area is opacified, so light rays cannot pass through that area. That leads to deterioration of vision or such complaint like difficulty to see at night, this type of problems. Okay, so this is the total cataract. So here first cortical cataract happen, and then it grows to the nucleus. Okay, so total white cataract it is. Okay, this is also total white cataract. So this is also very nicely clicked picture. It is also total white cataract. Okay, so that's all friends, thanks for watching, and please don't forget to like my video and subscribe to my channel, and please don't forget to hit the bell icon so that you will get notification whenever I upload a new video. Thank you so much.